What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast.
Good morning, everybody. This is Dr. Zach Baker of R2P and R2P Academy. And with us today, we have one of our two sports residents, Dr. Abbey Hammann, who, again, has done a research article review for us. And I believe this one is on the elbow, wrist, and hand, which is the current topic that we're studying within residency today. So, Abbey, thanks for joining us, and tell us a little bit about the article you chose today.
So the article I wanted to dive into today is titled Hand and Wrist Injuries Among Collegiate Athletes, and looking at the role of sex and competition on injury rates and the severity of those injuries. For me personally, I wanted to look more in the rates of injuries prevalence, especially in sports, because over the last couple weeks, I've had a couple individuals come into clinic, either referred or direct access, that have hand injuries. A couple of them were scaphoid fractures. And then during my sports coverage hours, I've seen more and more hand injuries in spring sports compared to winter and fall sports. So I wanted to get an idea of, I'm seeing a lot more now these last couple weeks compared to the previous months of clinical time and sports coverage. So what is the incidence and prevalence within these sports, and does it depend on what sport it is and what season it is? So with current evidence right now, it's estimated that about 25% of all sports-related injuries involve the hand or wrist. Some of these are minor, but a lot of them can be a little bit more significant and require more prolonged return to sport phase. And a lot of times that's where we're going to come into play with physical therapy and potentially care after surgical treatments. With the high incidence going on, there's not really much data regarding like the severity of injuries and patterning, especially in college athletics. In 2004, there is a program called the Injury Surveillance Program that the NCAA uses. The athletic trainers are reporting these injuries into this program and classifying them based off of various different categories so that they can be inputted into the system.
Yeah, wrist and hand, I feel like for a lot of physical therapists who are not certified hand therapists, is kind of a scary part of the body for them. It's a very busy area, just when you think about the amount of anatomy that's there, with regards to, from the amount of bones that we have, all of the ligaments that connect the different bones within the wrist and the hand, from the muscles, tendons. There's just a lot going on. So I think from an anatomy standpoint, if you do not look at it semi-regularly, it's a little bit easier to get lost in that area compared to the knee or the shoulder or somewhere else. From a differential diagnosis, it is a very tight, small, confined space to deal with as well. So if you don't have a great understanding of what you're looking for and what the potential injuries are, and then how to actually execute and administer the test, it can be a very challenging area to work with, especially if you're a first responder or a direct access clinician. It makes sense when you think about fall and spring sport athletes. You have some sports that involve contact. And you think in the fall, we've got football. When you think in the spring, lacrosse comes to mind with that. You also have a lot of stick, racket, or just something where they're holding something in their hand. So think about lacrosse, tennis, swinging a bat for baseball, field hockey. So you have a lot of different stresses that are going through the hand and wrist that you may just not get with basketball or track and field and some of your other sports there. So I think the variety of injuries can be pretty interesting to work with as well. Is it more of a distraction or a compression-based injury? Is it something where they're hitting the ground? Is it something where they have an object that is striking them, or they are striking something with an object? And you can get such a variety of injuries with those different sports. So I think wrist and hand, it's a very I'm almost shocked that there aren't more injuries to that area. And I think sometimes equipment definitely plays a positive factor with that. But do you mind going a little bit further into the study with regards to, what were they looking for? What were they trying to accomplish with this? And what were they using to track some of that?
So the study itself was a retrospective cross-sectional analysis. The patient population was collegiate athletes, and they had to be participating in sports at the NCAA level. That could be Division 1, 2, 3. That part wasn't really separated throughout the study, which in the end was one of the limitations of depending on what level of competition you're at within the NCAA. Does that have a factor? With this, they were examining the injuries in regards to an individual's age, their gender, what sport they were participating in, if it was a sport like track, what event was that, and then the type of injury, utilizing the database with the NCAA. With the outcomes, they were evaluating data in regards to the injury type, if the individual needed surgical intervention, if there was time lost due to injury, or if they were injured but still able to continue to play, and then the gender, sport, and event as well. With this, they were excluding fractures in regards to radial or ulnar fractures because when those were reported, they weren't specific to where they were at along the bone. So they felt like that was a little bit too much of an outlier to try to group all of those into one thing rather than what was the fracture and like what type of fracture, because a lot of times the type of fracture wasn't necessarily reported. So they felt like that was too much to kind of generalize within the study. As far as inclusion, any hand or wrist injury while playing at the NCAA level, dates for this were 2004 to 2015. They split up these into two groups, so 2004 to 2009 and then 2010 to 2015, especially because there have been some rule changes within the last 20 or so years. So they wanted to account for that and see if like injuries were different between those 2 5-year segments. And all of these injuries had to occur in events of intercollegiate practice or competition that required the attention of their team AT or of their team doctor.
So they got a lot of stuff in there that they're looking at. Now, I do like the fact that they removed some of the radial and ulnar issues because you don't know if is this a distal or more proximal injury, and you don't want to have a medial epicondyle avulsion fracture being incorrectly labeled as a wrist or hand injury. So I like the data that they're collecting with this. What did they actually end up finding when they came in? What was the different things that they were hoping or expecting to find, and then what did the results actually show?
So as far as sports go, they kind of broke it up into like men's sports, women's sports, and then where both men's and women's sports were considered. So for men's sports, they had baseball, football, and wrestling, women's field hockey, softball, and gymnastics. And then for both genders, they had ice hockey, tennis, basketball, lacrosse, and soccer. When going through and crunching down the data, they reported the rates by per 10,000 athletic exposures. Just because there was a lot of data, there were over 92,000 entries for hand and wrist injuries throughout here. So they wanted to make it more, digestible for the data. So with this, they found that rates by sport, the highest rates in all exposure, men had a slightly higher rate exposure of 8.25, women about 8.21. Both of these were in ice hockey and had some of the higher rates. As far as highest rates in competition or gameplay, football was about 31 per 10,000 athletic exposures, and then men's ice hockey was 22 per 10,000 athletic exposures. As far as practice, with practice, gymnastics was the highest, but if you think about that a little bit, they're practicing all these crazy skills throughout practice, and then competition is just a one and done, as opposed to the however many hours. I have a couple gymnasts right now that are practicing around 4 hours a day, 5 to 6 days a week. So that compared to a couple minute routine, it kind of makes sense, at least for me in the end.
Yeah, definitely have probably more exposures in practice than in competition with gymnastics. And I think gymnastics is a sport that is a little bit more challenging to scale. It's tough to really do lower intensity, lower impact, lower force production tasks that are truly going to translate to your performance. So it's kind of an all or nothing type practice scenario, whereas with some of your other more traditional field and court sport athletes, there's ways to get meaningful reps in that don't involve the level of impact and contact that you would see within a game.
As far as injury types, they had quite a few that they categorized by. The ones that I found most significant were ligamentous was the most common injury with about 1.5 per 10,000 athletic exposures. Metacarpal fractures were the second most common, and then followed by scaphoid fracture and dislocations. The dislocation was not specific to any bone. It was just kind of grouped to carpal bones in general. As far as injuries requiring surgery, overall surgery rate was about 3.78% of all injuries reported required surgical intervention. I felt like that was a good bit considering having some exposure into the college setting and getting some hours on sideline coverage with a lot of the ATs around the area. I thought that was kind of a crazy percentage. Yes, it's only 3.78%, but as far as how many injuries I've seen every weekend, the fact that none of those have been requiring surgery quite yet, that was kind of surprising to me. As far as fractures, 11.9% of all fractures required surgical intervention throughout this study. Women's field hockey was most likely to require surgery. 7.5% of all reported injuries in field hockey as a sport were going to require surgical intervention. This was in the discussion later on through the article of maybe this might be helpful to look at women's lacrosse and how we still use protective padding, even though it's not as much of a contact sport as men's lacrosse, and potentially we could negate some of these injuries from field hockey sticks or ball. So just keeping that in mind, I think was very helpful for me to see like how can we improve injury reduction and reducing and prevention. As far as women's gymnastics, they were most likely to require surgery just for fractures in general. If you think of the high velocity activities you're doing in gymnastics, that makes a lot of sense, but about 27.3% of all fractures that were sustained in gymnastics, whether that was practice or competition, required surgery. As far as taking all female athletes with fracture from this database, 13.8% of the fractures were from this group, women's gymnastics. So looking at the intensity of the sport, it makes sense, but seeing the numbers kind of straight out in front of you is a little bit surprising. As far as men's surgery rate, 4.22% of all injuries required surgery, and then 11.46% of all fractures required surgery. So numbers are a little bit of the same between genders, but then depending on sport, a little bit different.
Now, did they get into anything such as like time loss associated with the injury or time away from competition? And were there any just generic gender differences?
Yeah, so they looked at time loss after injury. A lot of it was kind of grouped together because some of the cases didn't necessarily report time loss after injury, and that wasn't instituted until 2009. So we're only collecting time loss after injury with the 2010 to 2015 group. So I think that's still important to consider. Like, yes, these numbers are still value that we'll talk about in a second, but at the same time, consider that it was only for half of the length of the study that they were looking at this for. As far as mean lost time overall for all genders, all sports is about 7 days. The longest mean time for men's sports was with wrestling, and that was about 2 weeks or 14 days. The longest mean time loss for women's sports was kind of almost split even between gymnastics and hockey at about 10 days each.
And then anything in regards to patterning with like men's versus women's for injury rates?
So for injury rates, males had an inherently higher injury rate with 6 injuries per 10,000 athletic exposures, whereas females were around 4 injuries per athletic exposures. Men in general had a longer mean time loss after injury by about a day. They're more likely to require surgical intervention with an injury, almost twice as much as the female population. And then surgical intervention, specifically with fracture, was higher in males by about 2 to 3 times over.
And then it mentioned field hockey having 3 times the injury rate and severity considered to women's lacrosse, potentially due to stick or ball contact, and maybe making the consideration, as you had mentioned, like what can we do from an equipment standpoint to put people at an inherently less risk, and the consideration to wear gloves in field hockey. Speaking from experience, I have 2 daughters that both play outdoor and indoor field hockey. The ball moves incredibly fast in both sports, and especially in indoor field hockey. And the ball is actually not allowed to leave the ground unless you're shooting in indoor field hockey. So because the ball moves so quickly and because you have to keep the ball on the ground, a lot of times when you're stopping and when you're maneuvering the ball, you have to get your stick almost parallel to the ground to make contact. So your hand and knuckles are maybe an inch, 2 inches away from the ground. They're required to wear it. I don't know if it's actually a league rule or just the club team that they play on. They're required to wear gloves in indoor. And now that they've worn them with indoor, they would never even consider not wearing them for outdoor. And I feel like it's maybe a nuisance when you add padding and equipment to different sports, but I couldn't imagine trying to play a sport like that with the level of contact and just the closeness of contact with the hand and the wrist in regards to where the stick and where the ball is. So it will be interesting to see. Women's lacrosse has made a lot of changes in the last decade with regards to how physical they allow them to play and the amount of contact that they're allowed to do as a defender when they initiate contact with an attacking player, how hard they can ride, how much they can, I don't want to say push, but initiate and maintain contact. So it will be interesting to see. People made a big fuss when they had to start wearing goggles, and now that's like an afterthought at this point. So I'm not going to say they're going to put helmets and shoulder pads on them, but I would not be shocked if you start to see some of these sports, whether it's men or women's, that don't traditionally have padding associated with them, start to implement something in the future. With this article, what were either just some general, whether it's results or conclusions that were drawn, or what are your big takeaways from this?
So my big takeaways overall are just looking collectively at the study that males are going to have a greater inherent risk of injury than females. They'll probably most likely require surgical intervention, which might lead more of these athletes to come see us after the fact, and that the time lost due to injury may be a little bit longer for males. So I think that's important considerations just in general, especially as clinicians, to get an idea of what is like the typical return to injury timeline, just so we have an idea, especially when it comes to like patient education of, hey, this is how other people in similar situations as you are having to sit out for. Now everyone's a little bit different, but just to kind of give like a ballpark, because I think like that's the big thing for athletes is, hey, I can't play right now. When can I get back? I need to get back. I want to be playing. So I think that adds a little bit of value, and just having a little bit more knowledge, especially if you're someone that's working in a college setting with these athletes, like who's more at risk, because that's important considerations to have. Overall, I thought that it was surprising as someone that has not had much exposure to field hockey, especially when I was younger and I never played, knowing that that is one of the second highest injury risks, secondary to gymnastics. And I would say those sports are very different, and being so close together in rankings as far as injuries was pretty surprising to me.
I think I echo all those sentiments. And then with me, you and I work together in the clinic, and everything that you said I agree with. A couple of the other roles that I have to be considerate of are program design within the sports residency and curricular design. How much time do we allocate to shoulder injuries, to knee injuries, to hip injuries, to wrist and hand injuries? And having information like this that gives you an idea of the incidence and the prevalence and the rates of injuries at specific body parts, you can start to see maybe they're happening a little bit higher, happening a little bit less than we thought. And does that, or should that influence how much we incorporate it into our curriculum from a discussion standpoint, and also from a skill building standpoint as well? Then when you think about this from a staffing standpoint, so maybe you're a director of rehab in a collegiate or professional environment, this may influence how many personnel do we have on staff. If we have 5 different competitions and practices going on, if we know injury rates associated either with genders or sports or body parts or practice versus game competition, that may help us better allocate and triage where do we put our resources. And if I have 5 competitions going on but only 3 bodies to cover those competitions, which one do we pay the most attention to with a direct presence versus which one may we try to just have somebody close on standby that they can get there as needed? And almost making the best of a less than ideal situation. So I think there's a lot of cool things that you can take from an article like this. So Abby, I appreciate the time and efforts as always, and be tuned for next month when I believe we get into...
I think emergency management maybe?
Yes, emergency management. So, Abby, thanks. And if you're listening, stay tuned for next month.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.